Hello, I'm Mike Abrams, President of the Ohio Hospital Association. I'd like to tell you a little bit about who we are and what we've accomplished over the last century. We're celebrating 100 years of being the united voice of more than 220 Ohio hospitals and all the Ohioans these medical institutions serve, as well as the nearly 250,000 Ohioans employed by our hospitals. Our mission is to collaborate with our member hospitals and health systems to ensure a healthy Ohio. And here's how it all got started.
Ohio's hospital history is decorated with firsts. Cincinnati was the hub of early medical practice in Ohio. The Cincinnati Commercial Hospital and Lunatic Asylum, our uniquely named first hospital, opened in 1823. By 1849, Starling Medical Center College St. Francis Hospital was established on the present site of Grant Medical Center in Columbus as the first teaching hospital in the U.S. It was the forerunner for the College of Medicine at The Ohio State University. 8 hospital superintendents met in Cleveland in 1898 to discuss common concerns and form the Association of Hospital Superintendents. The group expanded and later changed its name to the American Hospital Association. The early 1900s was a decade of firsts. Alexander Graham Bell made the first transcontinental phone call, and the Wright brothers from Dayton flew for the first time. In 1915, the Ohio Hospital Association became the first state-level hospital association in the country, providing a united voice for the 87 Ohio hospitals caring for Ohioans at the time. Members gathered at the Hotel Breakers at Cedar Point to launch the organization. With the onset of World War I, Lakeside Hospital, now known as University Hospitals, deployed the first American military unit to Europe. The Lakeside Unit, today the 256th Combat Support Hospital, was the final U.S. medical unit to leave Iraq. The Roaring '20s were a time of great flair and change for our country. OHA celebrated its 10th anniversary back at the Breakers Hotel in Sandusky. Mary Yeager, the association's first woman president, delivered the opening address. By the 1930s, the U.S. was in the grips of the Great Depression. Ohioan Jesse Owens won 4 gold medals at the 1936 Olympics. Scientists at Cincinnati Children's Hospital developed a method for preserving and transporting whole blood, which later saved lives on the battlefields of World War II. Elyria Memorial Hospital's Dr. Edgar Allen established the Easter Seals campaign, which later becomes the Easter Seals Society. The 1940s were dominated by World War II and the dawn of the Cold War, driving great manufacturing and technology advances on the home front. At the Cleveland Clinic, Dr. Irvine Page and colleagues developed a modern research program concentrating on brain chemistry and hypertension. In 1948, they isolated the neurotransmitter serotonin, opening a new age of psychiatric drugs. Dr. Claude S. Beck of University Hospital in Cleveland performed the first defibrillation of a human heart. Times were changing in the 1950s. The post-war economy spurred great advances in everyday American life. The television went into mass production, passenger jets took off, and medical advances escalated. Metro Health's Dr. Frederick C. Robbins won the Nobel Prize in Medicine for his work in pediatrics and contagious diseases, which paved the way for Dr. Jonas Salk to develop the polio vaccine. The tumultuous 1960s brought us anti-war protests, the golden era of rock and roll, and put the first man, an Ohioan, on the moon. Columbus Children's Hospital, now Nationwide Children's Hospital, created the nation's first birth defects study center and world's first rhinovirus research lab. Cincinnati physician Albert Sabin developed the oral polio vaccine. 20,000 doses were administered the first year. University of Toledo College of Medicine was founded as the Toledo State College of Medicine by a special session of the Ohio General Assembly, making it the 100th medical school in the country. In the 1970s, the country was consumed with Watergate. The last helicopter left the U.S. Embassy in Saigon, and Saturday Night Live premiered. The nation's first emergency medicine residency was established at the University of Cincinnati College of Medicine. Neonatologists at Rainbow Babies and Children's Hospital conducted groundbreaking research on maternal-infant bonding that revolutionized postpartum care practices. In the 1980s, the power of computing accelerated entrepreneurship and scientific advances. The Berlin Wall fell, and the first mandatory seatbelt law went into effect in New York. The nation's first remote, non-hospital-based medical helicopter was placed in rural Wellston, Ohio by Grant Medical Center. Now known as MedFlight 3, the helicopter brought time-saving air medical resources to critically ill and injured patients in all corners of Ohio. As the 20th century came to a close, Y2K created tech fears, and the Rock and Roll Hall of Fame opened in Cleveland. The Ohio State University Wexner Medical Center was the first U.S. medical center to perform a complete heart bypass using minimally invasive robotics technology. The world celebrated the new millennium and handheld technology exploded with the 2001 launch of the iPod. Facebook launched in 2004. There are now 1.2 billion active users worldwide, connecting our communities and our patients to our hospitals and health support groups. Cleveland Clinic researchers identified the first gene linked to heart attack. Ohio State's Michael Caligiuri discovered the site and stages of human natural killer cell development. The philosophy that began in 1915 is evident 100 years later, supporting our members and all Ohioans.
Hi, I'm Sherrod Brown. It's my privilege to serve as a United States Senator. It all started for me at Mansfield Hospital, where my dad worked and where I was born. I doubt that back then I appreciated all that hospitals do for Ohio, but I certainly do now. Happy 100th birthday to the Ohio Hospital Association. I look forward to what we can do together to serve this state in the years ahead. Thank you so much.
Hi, I'm U.S. Senator Rob Portman. I wanted to take a brief moment and congratulate the Ohio Hospital Association and all those who are part of this wonderful organization on your centennial celebration. Since opening as the nation's first state hospital organization way back in 1915, you've accomplished a lot these past 100 years. Whether it's been working to prevent infant mortality, reduce readmissions, or improving patient care, you've truly lived by your mission to ensure a healthy Ohio, and I'm thankful for all you've done. It's an honor to be included in this wonderful event, and I want to wish OHA a very happy 100th birthday.
Today, the mission of the Ohio Hospital Association is as steadfast as it was 100 years ago. As we celebrate our centennial birthday, we remain the united voice for Ohio hospitals, committed to advocacy, patient safety and healthcare quality, and economic sustainability. We're doing this in an era of unprecedented change in our industry. By the way, I too was born in an Ohio hospital, St. Anne's, when it was on Brighton Road in downtown Columbus. The Ohio Hospital Association is working hand in hand with policymakers and business leaders to create new models for healthcare delivery in our state. When the OHA was born, hospitals were limited to comforting patients and trying to understand diseases that were impacting Ohioans. We still do that today, but we've become so much more. Technology and treatment discoveries are being developed in Ohio hospitals every day, and these innovations are benefiting patients not just here, but around the world. We're leading preparedness for natural disasters and emergency needs in communities throughout the state. Maybe we'll be gathering 100 years from now and discussing technology and innovation we can't even imagine today. Our challenge is to shape this future, and I'm so glad you're all taking this exciting journey with us. Happy 100th birthday, OHA.